Many of us living in the Northern Hemisphere are all too familiar with the sight of leaves gradually changing from green to red, orange, brown, and eventually falling down. When we see this, we all know that it's a sign of winter on its way and a matter of time before the snow and cold arrives. For many out there, winter not only brings snow but also a loss of energy, trouble sleeping, and feelings of hopelessness. Today we will be discussing seasonal affective disorder, also known as SAD, and how weather impacts our mental and physical health.
This is the Public Health Insight Podcast.
Hi, my name is Will, and I'm here today with the usual team of Ben, Gordon, LaShawn, Linda, and Sully.
Before we move on, it is important to note that the views expressed in this podcast are our own and do not represent any of the organizations we work for or are affiliated with.
Please note that this episode will cover topics related to depression, suicide, and mental health struggles, and may contain sensitive or triggering content. If you or someone you love has been impacted by suicide, you are not alone. Please use your discretion when listening and connect to supports as needed. For our listeners in Canada, Crisis Services Canada offers a national suicide prevention hotline, which can be reached at 1-833-456-4566 or by texting at 45645. All right, team. So as always, we like to start off our episodes by introducing the topic. So today we'll be talking about seasonal affective disorder, also known as SAD. Yeah, so one thing that I learned while researching this topic is that it's actually considered a type of depression rather than just something that individuals feel, which I previously thought, when people say seasonal affective disorder, I thought, it's kind of just, like the term states, winter blues. I thought it's something that's just kind of just, thrown around people, like a social construct even, Right. But the Mayo Clinic clearly defines seasonal affective disorder as a type of depression that's related to the changes in seasons. And, typically, I think people are more familiar with what's called the winter pattern SAD, which is usually begins around the same time, around a fall, early winter, and continues throughout the winter months and eventually goes away during the early spring and summer time where the days get longer. But actually there's another form of, which is less common form of SAD, which affects people in the spring and summer months and ends in the fall, and this is called the summer pattern SAD. So I just thought that was quite interesting, that it's not as rigid as I previously thought, that only something that has to do with winter, but it's something that maybe has an inherent seasonal clock aspect to it.
Right. Yeah. It's like by nature, it's just the seasonal part of it just comes from the relative period of onset every year is pretty stable. That whether it's summer or winter, it's just something that kind of hits someone at certain times of year.
Yeah, I think another component of it is that it was formally recognized in the 1980s. And even before then, within history, we've seen it pop up in texts where people describe, having those winter blues, quote unquote, during the winter season. So it's interesting how we're still learning more about it. Like initially I said, maybe it's just all based on sunlight. But now we can see that there's a version of it in the spring, the summer, where there's plenty of sunlight. So what's going on here, right?
Right. And that's an interesting point you bring up, Ben, because it was only more recently, like you mentioned, in the 1980s, when the person who actually coined the term seasonal affective disorder, his name was Norman Rosenthal. And so his story kind of went like this. So he moved to the United States after living as a native South African for a period of time. And he noticed that when he moved, he felt less productive in the winter. But when things returned back in the spring, he returned back to quote-unquote normal. So he's been doing work with the National Institutes of Health in the US, and he's done a lot of research in melatonin and how melatonin and suppressed melatonin because of light impacts your circadian rhythm.
So in terms of SAD, I think it's one of those things that I think is how the condition affects individuals is very different. But some of the common signs and symptoms of SAD include things like that are also commonly associated with major depression, right? Things such as losing interest in activities one might have once enjoyed, having lower energy, problems sleeping, And I found it very interesting through the research that winter pattern SAD versus summer pattern SAD had very specific symptoms, depending on which time of year and what season was being affected. So, for example, the winter pattern, often individuals experienced oversleeping or hypersomnia, overeating, and whereas the summer pattern, the individual experienced trouble sleeping and poor appetite. So I found that really interesting. That it's almost kind of like an opposite in a way for the symptoms that people might experience in winter versus summer.
And I wonder if temperature is a confounding variable for that. Like, for example, some of the summer SAD symptoms are irritability, anxiety, like restlessness. And there has been some studies where show like if you're in a hotter environment, you're more irritable versus being in a colder environment, right? So it's so complicated in terms of trying to tease out what exactly are symptoms, what are the histories of these people, how can we help and target intervention.
Yeah. I wanted to point out that when I was doing a lot of my research for this episode, I found that there actually was a distinction between seasonal affective disorder compared to winter blues. Is there something that kind of distinguishes the two terms?
Yeah, so this is to my understanding. I want to say that seasonal affective disorder is more of a clinical diagnostic.
Correct.
Right. It's, as mentioned earlier, it is considered a type of depression, whereas winter blues, how I understand it, is that it may or may not be clinically diagnosed. It, sometimes people can kind of just say they have winter blues, and I find that when I was looking up the term and just doing the research, there wasn't a lot of concrete agreed upon data and symptoms as to what would constitute as winter blues. So that's kind of what I thought. Anyone else have any comments?
I see winter blues as, that feeling when you wake up and it's dark, and then you come home from work and it's dark, and you're just like, when am I ever going to see sunlight again? And it's so cold, and it's that overall general feeling of, okay, it's winter. But once that is something that's persistent and it's like impacting your daily life, perhaps then it could drift a little more into SAD, like seasonal affective disorder.
Right.
And part of the clinical definition too, I believe, is over a period of 2 years for it to be considered chronic, where it's considered a disorder. And winter blues is probably just if you're experiencing just a few of the symptoms of whether it's winter onset or summer onset, and it's not like a part of an overall chronic debilitating condition. So
I do think it's normal to feel winter blues to an extent. I mean, I'm sure we all have that feeling when you look outside and you're like, oh man, like I have to brush the snow off my car, and it's cold. So I don't want to pathologize that too much, but to feel like winter blues to an extent. But definitely, Gordon, like you're saying, if it's chronic and persistent, then we can get more to a clinical diagnosis.
Yeah, and I think it's, as we mentioned at the beginning of this episode, I think it's a very good point, Linda, that you brought up, that, and Gordon. So I think it's something that's very natural. I would say part of our human nature is that previously, let's say the sun would be up till, in the summer times, it would be up till 8 or 9 p.m. And in the winter times, it's like pitch black at 4:30. I think there's a certain part of our body and just our nature where it's like, dang, this is, it's not ideal. But I think, the key point is that if it is something that's ongoing and you are seeing, whether in yourself or your loved ones or those around you, aspects of their daily life being drastically changed or affected, we once again like to stress that it's important that you reach out to the appropriate services, to seek help and professional help.
That's cool, because I wonder if there's any evolutionary kind of reason why we experience the winter blues. Because I'm thinking, I guess, if we're not thinking about modern humans and we're thinking about, sunlight played a huge role in the ability for individuals to go out hunting, gathering. And so you would think that when it's more, when it's dark outside, will you be safe when you're going to do these activities? So maybe
energy preservation as well.
Exactly. So maybe it's kind of a sign that the body is showing, there's not a lot of sunlight out. Maybe the body's response is to be a bit more groggy and sleepy.
I would argue against that, actually, because my perspective is this. If we're going back to evolution, natural instincts, it's within those winter months where, food is scarce, where you need to be at your top peak of performance to find food and hunter gather and make sure that you're okay to survive the winter. So
That's interesting
that would be my
point too.
perspective, right? Like that's when it's fight or flight. You're always on time. So maybe you have like chronic stress, and that fatigue may contribute to these depression symptoms. But I think that's a whole other tangent.
Yeah, but we're also keeping in context the fact that we are looking at seasonality, and during the winter months we typically get less sunlight, and so during those periods, that's what we're talking about with seasonal affective disorder.
And keep in mind with this stuff too, there's levels to it, right? So there's a lot of things that affect which geographical regions get more sunlight, right? So if you're closer to the equator, seasonality is less important. If you're further away, like we are in Canada, seasonality becomes more important. So it's definitely not kind of, you can't really make a lot of generalizations, even with the example of evolution. But it does seem like, you know, we know, for example, sleep that it does have an evolutionary function, and we don't know a lot about seasonal affective disorder. So it's unclear kind of what exactly the role this played in kind of the beneficial role of having these kind of symptoms of energy preservation and sleep during the winter, but like more research is definitely needed for sure.
Yeah, because as we know, the decrease in sunlight may disrupt your body's internal clock when you go and talk about biological clocks and circadian rhythms, and we know that leads to feelings of depression. But I think the whole evolution thing could be argued either way.
And definitely less sunlight means less vitamin D. And I believe I read somewhere that said majority of people in North America are deficient in vitamin D just because of, you know, where we live in terms of the latitude and sun. But especially if you have darker skin, your vitamin D levels are lower due to just your melanin levels. So
Correct.
we should all be taking supplements.
Yeah.
I mean, talk to your doctor,
yes.
but
Yeah, straight up take supplements.
And
After the doctor,
and also
disclaimer.
like there's
not
also
medical advice.
also there's a myth too, like not to get sorry, Will, you can bring us back whenever you're ready, but you know, unprotected exposure to sunlight is you need to get vitamin D. That's not true. You only need a couple minutes a day of sunlight to get your daily vitamin D dose. So there's kind of a misconception that you have to trade off protecting your skin to get the necessary sun exposure that you need, and that's not true.
Right, and we will be covering that topic in a future episode, so stay tuned. Anyway, so I think we had some great discussions there, but kind of going back to what Sean mentioned earlier with melatonin levels, and you know, also comments about the biological clock, the circadian rhythm. I think these are, at least from the literature and from the research, it says, appears to be some of the factors that come into play affecting and causing seasonal affective disorder. Maybe, you know, we can expand on these, or if anyone has any additional points, like I think Linda's point about vitamin D deficiency was also, I also saw that in the research saying, you know, playing a big part in causing SAD. But yeah, open the floor here to see if anyone has any other you know, comments or factors here.
What I found interesting was that, you know, you had mentioned serotonin, and in general, we know lack of serotonin is a factor for depression. But what I found interesting was that reduced sunlight leads to a drop in serotonin that can then trigger depression and seasonal affective disorder. But I didn't know that there was that relationship between sunlight and serotonin. And so now when I put that together, it just makes so much sense. It's, well, of course people experience depression in the wintertime if, you know, we're getting less sunlight. If you already are someone who may have lower serotonin levels or who is just already, you know, predisposed to experiencing depression, then this time of year will be extremely difficult, you know?
Yeah.
It's a very good point. I think one of the things that I was, as we've all, you know, researched and looked up this topic, is that I think it's just like a wow moment. It was like when I realized how much, I guess how little we actually understand about this topic, because you know, everything about vitamin D deficiency and melatonin and serotonin, all that stuff, it seems to kind of make sense when you're looking at the winter pattern SAD, right? But how it's like, and then when I kind of bring in the summer pattern, it's like, how does that fit in? Because in the summertime, that's when we have the most sun. And how are, if there's already a lot of sunlight there, it just kind of got me thinking, and I realized, wow, this.
No, that's a good point, man. Because
we know so little.
It's a good point, because it's almost like when you dig into things deeper in terms of the underlying causes for each one, is it like an entirely different disease almost that just happens to also be seasonal? It makes you think. You're 100% right.
I'm wondering, as you know, like our body adapts to different types of conditions depending where you live, right? And like our bodies adapt like generation after generation once we live in these conditions. Is there any research that talks about like any differences between populations in the same location, say immigrants, newcomers versus people who are already there, who might have adapted?
You trying to do a PhD?
It's a PhD question right there.
That's a very interesting. I mean, anyone have anything?
I actually have something. So in research for this episode, I came across some kind of studies that talked about how in some Scandinavian countries, where there's kind of lower levels of sunlight, you don't get this kind of level of expected seasonal affective disorder that you expect from such low levels of sunlight. So it suggests that Will kind of touched on it. There has to be other factors besides sunlight that play a role in winter blues or seasonal affective disorder. Not much is known about this disorder, unfortunately, and more research is needed. That's why Sully, immediately following the conclusion of this episode, will pursue a PhD in seasonal affective disorder.
Yeah.
Thank you, Sully.
It's a very good segue, Gordon, that you made to kind of the Scandinavian data, and also a point you mentioned earlier about your geographic location and where you live, because that's one of the other risk factors for seasonal affective disorder is how far north or south you are from the equator. Because I think we all know that the closer you are to the equator, I guess the fluctuation in seasons and kind of the daylight hours is diminished. So, for us living in Canada, we're quite...
Because the world is not flat, by the way.
Yes, there we go. Yeah, so for us living...
Another PhD.
That's for you, Kyrie Irving. Sorry, Will, I had to do that.
No, anyway, yeah. So, related to that, some of the other interesting risk factors that I noted, I guess when I was looking this up, was that seasonal affective disorder seemed to be more common in people where this condition ran in their families. So, if an individual have relatives in their family with either seasonal affective disorder, major depression, or other mental illnesses, such as schizophrenia, it's the likelihood of that individual also having seasonal affective disorder is much higher. Yeah.
So would that be one of the things that distinguishes SAD from normal winter blues? And it actually combines with other complications like depression and anxiety?
Yeah, well, I think SAD is I think we'll touch on it, is almost like a subtype of major depression, if I'm not mistaken.
Yeah.
That's kind of seasonal in nature. That also overlaps with a lot of symptoms of depression. And we know that depression is a mental illness. So it does make logical sense that there would be links to other mental illnesses, such as bipolar disorder or schizophrenia, but I imagine that just like our talk 5 minutes ago, there's still a lot of research left to be done to see how exactly do these interact with each other.
And another interesting risk factor that I noted was that it's stated that SAD occurs much more often in women compared to men. I like to open this point here for discussion. I know Linda had some comments about this one.
I mean, firstly, I'd like to see a source for your information.
Yes, we the evidence.
But also, I think that this is probably really telling with how we talk about mental health within our society, right, there's always those gender differences and stigmas related to maybe men speaking out or obtaining a diagnosis, or even hurdles in getting a diagnosis, because seasonal affective disorder may present differently in men than in women. So there's so much to unpack there, but what do you guys think?
Yes. So just to answer that, so for our listeners out there, I didn't just pull this.
Oh, I was kidding.
No, I know. I don't want to get smoked. This point was from actually the Mayo Clinic. So
yeah, Linda, like you kind of allude to some of the complications here, like where men may be, maybe less inclined to say that they're struggling with certain mental illnesses, but what I'm wondering is, I imagine it would be hard to make diagnoses for seasonal affective disorder because, as we mentioned earlier on, there's so much overlap with so many other mental health conditions. So is there underrepresentation of that?
That's true.
Yeah, also too, in order to be diagnosed with seasonal affective disorder, you must have gone to a clinician to be diagnosed with seasonal affective disorder. And we know that for issues of mental health, for whatever reason or another, men are less likely to pursue those kinds of supports. And as a result, there may be some underreporting there as well. It's less clear if these gender and sex differences are related to anything that's biological in nature. We know there is biological involvement with melatonin and serotonin, but we don't know if there are some inherent gender differences that lead to these outcomes that we see. But Sully will let us know in 4 years when he's done his PhD.
Common theme, more research.
Yeah.
From Sully.
Yeah.
So now that we've kind of introduced the topic of seasonal affective disorder, as we always like to ask ourselves, why care? Right? Why do we bother talking about this topic? Why is it really significant? Like, what's the public health significance here, and why should kind of people interested in public health, or even just us as public health professionals, be mindful of this topic?
So, as mentioned earlier, SAD is a type of depression that reoccurs annually based on seasons, and depression is a common illness worldwide affecting over 264 million people. And at its worst, depression could lead to suicide, as we mentioned in the previous episode, with over 800,000 people dying by suicide each year. So, as we already mentioned, there's a lot of overlap, and there might be a lot of, issues with diagnosis of seasonal affective disorder. So there might also be a underrepresentation of what the actual public health problem is. So it might be greater than we actually know of.
Yeah, and then also when approaching interventions that we implement from a public health lens, it's important to take into account these types of illnesses because of the overlap, as LaShawn and all of us mentioned in our previous conversation. Because if you target interventions, say specifically for suicide prevention or depression, you may also help individuals through unintended consequences who are suffering from SAD. So just understanding that nuance is important because it gives you more options.
And to bring it back to seasonal affective disorder a bit, from my research, it seems like the lifetime prevalence of SAD, which is basically the percentage of the population that is diagnosed over their life course, was about 1 to 3%. So it just shows that, you might say 1 to 3% is not a very large number, but then if you kind of take 1% of the world's population, that's millions of people that are affected. So it just goes to show that it is a public health issue.
Yeah, I'm not even sure if that stat takes into account, I guess, the latitude, or if the further away you are from the equator, I'm guessing there's going to be higher percentages, like here in Canada, for example.
And then that also, in order to have a more accurate number, we'd probably need to know the percentage of the world's population at the different latitudes to be able to make a better estimate.
It's a good point because regional differences for the prevalence of this condition affect a lot of the interventions that you implement, right?
At least we know in the above the equator, in the temperate zone, it's 3 to 10% prevalence of SAD, and in a random country, say Hungary, it would be 4.6%. So it shows that how important it is to like where you take your stats from. So if it's like in the temperate zone, which is like above the equator, you're more likely gonna find people with SAD versus in the equator. So if you take the stat from the overall population of the globe, you're gonna get 1 to 3%, which is a low. You can say it's a low number relatively, but as you go up, you'll find the prevalence increases.
Right. So the overall population or the overall statistic doesn't take into account those regional differences.
Yep.
Yeah. The context.
And then, like I mentioned earlier, there are kind of anomalies to that general rule of thumb where you have countries, Scandinavian countries, that are further away from the equator that don't have the expected percentages of SAD. So there's a lot of different things to consider. Yeah.
But when we talk about the Scandinavian countries and how, we're at similar latitudes, but they perhaps have lower rates of seasonal affective disorder. Will, I'm not sure if you remember how in MPHB studied vitamin D deficiency and how, which is, similar with sunlight. And we saw how a lot of, yes, it's biological, but the social and environmental factors played a really significant role in modifying the impact of vitamin D deficiency. And so I wonder what those social factors or environmental factors look like in Scandinavian countries where they're able to see perhaps the same, latitude, maybe the same amount of sunlight, but the impact is different. So I wonder what's the modifier.
Coming up with a nice point, because if you even think of maybe the social norm is that people just take vitamin D as supplements, so it negates that whole effect sunlight have. Maybe it's just more culturally appropriate to, modify your diet or take nutrients to make up for any deficiency. So they're it kind of buffers the effects of the lack of sunlight, maybe.
Yeah, the social and environmental context is so important. And from what I read, in Scandinavian countries, they have interventions in place that kind of normalize this, and we'll get to this in a second, but they have widely distributed things called light rooms, which may help.
All right, let's keep going.
Yeah,
well,
smart
I think
guy.
One thing I wanted to mention as well, I think as we were even just discussing the importance of having specific data is I don't know if you guys picked it up, but even just in our dialogue, we tended to only mention the northern temperate zone. I think it's important to also recognize that, for example, there's massive populations in the southern temperate zone, which might not even be represented in the data because they kind of just get forgotten when talking about this topic, right? And I think large parts of the world, which is geographically located in the south, but in terms of like the globe, they would be considered in the temperate zone. So it's, like the reoccurring theme of this episode seems to be that there's the need for more research, and also not only isolating and just focusing the research in kind of temperate zones north of the equator, but even areas south of the equator, and kind of making that comparison to seeing if this is something that also affects the populations there. I just wanted to throw that in there. And
great point. And shout out to our listeners all across the world, by the way. Thank you for tuning in.
Yeah. Another point I want to talk about for the significance of SAD is that this is something I just learned preparing for the episode, is that there are so many interrelationships between depression and physical health. And that depression was actually one of the most common comorbidities for many individuals dealing with chronic medical conditions such as cancer, cardiovascular disorders, etc. And so that just got me thinking that, for an individual who might be undergoing treatment for these chronic conditions, just how SAD can also impact just their overall mental and well-being, in addition to them being in conditions where they're physically unwell.
Like, it impacts every aspect of your life. It's not like you can say, oh, well, depression or SAD is just gonna impact my sleep, but it will also impact how you eat, your relationships with other people, physical activity, which then leads to other like illnesses within your body too. So yeah, it impacts every aspect of your life. So when talking about the public health significance, I think that it's a fairly large significance in public health.
And it kind of ties back to what Ben said about, suicide being one of those symptoms. So with seasonal affective disorder, because there's a lot of comorbidities that go along with it, you kind of have to use a multi-pronged approach to and tailor it to the individual to ensure that all their other health needs are being met while you're treating SAD.
Yeah.
The last point I wanted to touch on for this section is considering the COVID-19 context. So, for our current listeners, this is something that we're dealing with right now. And, for listeners in the future, at the time of recording in November 2020, the world is currently in the middle of a pandemic. And depending on where you're living, restrictions such as lockdowns, travel restrictions, public health measures are all in place. Just wanted to take this opportunity, now that I have the team here, to see if there's anything we want to talk about in terms of dealing with COVID as well as SAD and just kind of that interaction there.
Yikes.
Yeah.
That's a complex one.
Especially since it goes to a lot of treatment access, right? Regarding these lockdowns.
Yeah.
Like, for example, if people who are mindful that they might have SAD symptoms and their treatment is to either go to like these light rooms that LaShawn mentioned before, or like maybe travel to a different country.
Yeah.
And they're unable to do that. How are they coping, right?
Yeah.
I was really curious, and I could not find information on this, but, when COVID first hit us in the springtime, we were going into our summer, but, people in Southern Hemisphere, they were going into their winter. So I was curious to see how COVID impacted things like SAD, and how COVID interacted with just the seasonal differences. In places like Australia, for example, who are just coming out of their winter as we are going in. And I wanted to see if there was any just information to see how that experience was over there, but I couldn't quite find anything. But I always forget anyway that our seasons are opposite, but they've encountered this already. So
and you almost wonder too, from a personal level, you're socially withdrawn, maybe you're eating more or whatever, you're exercising less, and it's just like, is it because things are closed and there's not much to do and you feel a little down, or is it because you're experiencing winter blues that could maybe turn into something more chronic like seasonal affective disorder? So there's a lot of confounding stuff because of COVID that makes it hard to tease out. But I know something that Ben likes to hammer home about is the importance of kind of using technology in terms of telemedicine to increase access to healthcare providers during times where it might be more difficult to access them. So for sure, if you're feeling down, reach out to your healthcare provider and get some help.
Yeah, I'm just thinking about just the stress levels of, individuals worrying about this pandemic, and we're relating that back to some of the risk factors of seasonal affective disorder, like we mentioned, like the circadian rhythm, your serotonin levels, your melatonin levels, and deficits in vitamin D. COVID-19, as Gordon alluded to, you might be limited to and restricted indoors for the most part, and especially now going back to our perspective in Canada, we have winter and it's very cold outside during Canadian winters. Are you as likely to go out on your usual walk or hike? Will you be able to get vitamin D through the sunshine if you're not doing that as often? Has the COVID-19 stress led to differences in your sleeping patterns and your overall biological clock? So there I could see some sort of relationship here, but of course this is all new to everyone, so as we mentioned before, more research is probably needed.
It's a very good point, and I think even just things that we saw at the beginning of the pandemic kind of come to surface, where organizations like the WHO were having concerns regarding prolonged periods of lockdown resulting in alcohol or drug misuse, more complex family or relational conflicts, things like that. And I can just imagine how with the changing seasons and just the seasonal spin on things, in combination with COVID, how these concerns might be compounded. And going back to what Linda mentioned about the point from looking at Australia or countries in the southern hemisphere, who have already gone through the winters, I think that's a really good opportunity for researchers or clinicians in this field to look to for best practices or examples or tips for how they might have gone through this period, and hopefully bring that over to our context if appropriate. Cool. So now we've kind of discussed what SAD is, and we've talked about its significance as a public health concern. Let's talk about if there are ways to treat SAD, and if not, for us as public health professionals, let's look at it from a lens of prevention and how can we work to prevent these symptoms and whatnot. I know LaShawn has been itching to talk about these prevention, so take it away.
Yeah, I mean, before we even get there, I want to point out that there's actually something called the Seasonal Pattern Assessment Questionnaire, also known as the SPAQ, that was developed by Rosenthal and his colleagues in 1984. And that assessment or questionnaire it continues to be used widely. And so this is basically a retrospective self-administered tool that screens for seasonal affective disorder, and it's widely available and in the public domain. So some of these questions that can be done by a researcher, self-assessment, and by your physician at a medical checkup, it really talks about, it compares the seasonality to the different moods you're experiencing or the different activities you usually do, such as sleep, weight gain, weight loss, how are you feeling generally? Do you eat less? Do you eat more? Your sleep length, your social activity, and your overall energy level. So these are some of the factors that are assessed with this. So I think that this can definitely be used as a part. And I'm not sure if a lot of clinicians or researchers are aware of this tool, and it's a common thing that I don't know if any of you have been ever in your life when you went to a doctor's office been given this assessment. But I think given the public health significance of this, it's something that should be looked into more, especially when we're starting to talk about different treatment options and prevention.
And I think just a point of clarification, I think because it's a screening tool, it's not a diagnostic tool in the sense of if you checked all the boxes, you are diagnosed with seasonal affective disorder.
Right.
It's just kind of, it's a way for, even as an independent patient, for you to assess your kind of symptoms to determine if you need to consult with your healthcare provider for additional help. And then at that point, they will go through a more thorough diagnostic kind of workup, which might include stuff like blood work to see if you are or should be diagnosed with seasonal affective disorder, and what some of those underlying causes are, whether it's the vitamin D deficiencies or other reasons.
So in terms of actual treatment then, from the research, what has the team seen is to be some of the appropriate categories of treatment out there available for this, or are there any?
Bibliotherapy.
Yo, don't kill me. So let me hop on the light therapy since I already alluded to it. So like I alluded to earlier, there's this intervention called light therapy or phototherapy, and it's basically a light box, a special light box that when you're exposed to this bright light, especially when you first wake up each morning, it helps kind of mimics the natural outdoor light that would be present and which would affect our brain chemicals. So these are one of the treatments commonly used to treat seasonal affective disorder. And typically individuals may have this special light box, and of course this light box is special in the sense that it shields you from the UV light. It doesn't include that as part of the spectrum of the light wave, just because UV light can affect your eyes and cause adverse effects. But typically in the morning, an individual would sit by this light box while watching TV, or whenever in the day that they feel it more convenient for them, and in consultation with their healthcare provider. But it's been shown to be pretty promising in many different situations.
Yeah, and another point of distinction with kind of light therapy is there is light therapy used to treat chronic skin conditions like psoriasis. And in those situations, light therapy does include some level of UV radiation as part of the treatment. But with phototherapy, specifically in the case of seasonal affective disorder, there is a filter to block out UV light, because UV light can cause skin and eye damage and can cause ultimately skin cancer, which is why tanning is not recommended. But yeah, so there are a wide range of benefits from that type of light that's used in phototherapy. And I believe listening to all the experts in the field, whenever you're buying a light box, you should get something with 10,000 lux. That's kind of the gold standard for light box therapy equipment. So before you even do that, though, check with your healthcare provider and make sure you get something that best fits your needs.
Yeah, have any of you come across any of these light boxes?
I've seen them on Amazon, but I was a little skeptical because I had not yet consulted with my healthcare provider.
There we go.
But it's definitely something that I want to try. Like, I do definitely experience a lot of these symptoms. And so, something that I'm open to exploring. You know what?
We're in an opportune time too, Linda, because it might be a little clunky for something that you want to take to work, before COVID, when a lot of people had to go to the office to work. Now a lot of people are working from home. It's probably a perfect opportunity to set it up next to your workstation and see if there's any benefits to you. So that's something I'll probably look into myself.
One of the other categories of treatment for SAD appears to be medication, right? Both from the lens of SAD being a form of seasonally recurring depression. So some individuals who experience severe symptoms have shown to benefit from antidepressant treatment and medications, obviously having been prescribed by a professional. On the other hand, for just the unique nature of SAD, taking vitamin D has also shown to have positive effects for individuals. Once again, the data is not super robust in the sense, so there definitely needs to be more rigorous testing for this.
Yeah, an aspect of that I found interesting is that usually with medications it's always prescribed, right? You need to see a clinician, and going back to your point with COVID-19 is like, how do you have access to that clinician, right? Like, do you need a prescription for serotonin reuptake inhibitors? Or if you don't have access to that, how can you just get over-the-counter vitamin D? Like, there's a lot more options available rather than just the strict depression medication.
Yeah, and the key thing with vitamin D that a lot of times gets missed is it's a point of diminishing returns with vitamin Ds. If you don't have a vitamin D deficiency, the benefits for you might not be as good as someone who does have a deficiency in vitamin D. So that's why it's always important to consult with your healthcare provider and get some blood work done to see if it's something that might benefit you, so that you don't go in with kind of big expectations of what might happen.
Yeah, and also you don't want to be consuming too much vitamin D because that could lead to overtoxicity.
Even though it's natural stuff can be bad in high quantities.
Everything in moderation.
But Ben, you did highlight some access issues in terms of, we keep saying, check with your healthcare provider, but do you have access to a healthcare provider? So that's definitely another lens to be considered.
No, absolutely, Linda. Like, how many people have family physicians? We often take that for granted, right? Or can you go into a walk-in anymore with COVID-19 lockdowns or those restrictions as well?
But so that is one point. But I will say, it's also important to know that there are people accessing health services but don't mention their struggles with depression. So at the very least, we hope that those people, that subset that does have access to healthcare services, would perhaps mention that in their appointments if it's something that's on their mind.
It's okay to talk about. Yeah.
Because what other categories of treatment are kind of commonly used for SAD?
So I guess just with depression in general, psychotherapy is a pretty common treatment method, specifically CBT, or cognitive behavioral therapy, which essentially just helps people to identify their thought patterns and how that influences their behavior, and to see the relationship between the two, specifically working on the more negative thought patterns or mind traps, and then trying to flip them so that they can be more beneficial, which could help people, learning different behavioral ways to cope with symptoms, such as reducing some avoidance behaviors, and you may be wanting to stay in and not meet your regular scheduled appointments. That might help to address some of those symptoms. So, and for the most part, CBT has it's often recommended because it generally tends to work. But again, with access, there's a cost involved. So it may not be an option for everyone, but I think that it's definitely something to consider if you have the means to access it.
Yeah, and cognitive behavioral therapy is quite effective when it comes to seasonal affective disorder. There was a study done where individuals were undergoing 6 weeks of CBT, or cognitive behavioral therapy, in a group setting during 2 90-minute sessions, and they found it to be as effective as 30 minutes of the 10,000 lux lighting box that we were talking about earlier. So it's definitely an option that we can consider.
I will say too that a combination of different methods probably would be more effective than just one in isolation. And so let's say for someone that is psychotherapy and light therapy, or for others that could be medication and psychotherapy. So it's not a one size fits all. And I think it's important just to highlight that what works for you may be different than what works for someone else.
Absolutely.
Absolutely.
Very good point. Just to wrap up, team here, I'd like to just briefly touch upon prevention, right? Seeing that seasonal affective disorder is one of those things that is recurring every year at roughly the same times, given the seasons. And people who have witnessed a history or have a history of SAD, I think it would benefit, and it would be a very upstream public health preventative approach to start considering some of these treatments leading up to that period of time, right? Because typically they occur at the same time every year, you almost have something to kind of know inside, how something
what's
to
coming,
expect it. To expect.
Yeah.
So I think that's a very valid and valuable approach for preventing this condition.
Yeah, in regards to prevention, we made a point earlier regarding Scandinavian countries and how they approach SAD. And one thing I found really interesting is that they implement prevention within their culture. So I forget the country. One of you guys can feel free to correct me, but
Norway?
Yeah, I believe it's Norway. They promote actually going outside with friends and whatnot to make sure that you have certain time just spent outside in the sunlight, whether it's by yourself or with friends. And they have an actual word for it. And I'm not going to pronounce the word because I'm obviously going to butcher it. But it's interesting how, we were talking about the differences in prevention for geographical regions, and why maybe Scandinavian countries are better at handling SAD than North American countries, or even countries in the southern poles. So yeah, those are cases that we can look at and kind of investigate.
I hate to be a downer. I hate to be a downer, but on the flip side,
Don't get me sad.
as you know, for the health unit, a lot of my work revolves around sun safety, and Norway's in the top 3 for skin cancer rates because of sun exposure. So there's
Well, you got me down.
there's a balancing act between getting the sunlight. The sunlight can be very beneficial to you, but also very harmful. So it's about putting yourself in a position where you can maximize the benefits of sun exposure and minimize the harms associated with sun exposure.
Ben, I think what I'm gathering from what you're saying is that instead of the onus of prevention only being on an individual to bring it up, if we could include more prevention activities within the culture, within society, then it's more likely that people in general would be able to access them.
Yeah, absolutely. Because a lot of the conversation has been clinical access, healthcare access, check with your clinician and stuff, and obviously do. But I think
We
from
know
a
that's
public
not
health
equitable,
30,000
right?
feet.
Yeah.
Exactly. It's not equitable. And also there's so much overlap that is a clinician properly trained to identify SAD? Are they just focused on more depression? There's so many nuances that I think more lifestyle changes would be beneficial. But as Gordon mentioned, always in moderation.
Right.
Yeah, when we're talking about prevention, I think it's it's very valuable to talk about some of the things that we can do in our day-to-day lives that can help. So one of the things that I came across was the fact that you can make environmental modifications at your own home, like we kind of mentioned for the fall safety episodes. You can make these modifications to, for example, modify and maximize the amount of sunlight you're getting. For example, keeping your curtains open for longer periods during the day. I know that in my room, I have blackout blinds.
Nice.
And so I keep those blinds down all the time. But after learning more and more about the importance of, a safe amount of sunlight exposure and seasonal affective disorder, I'm going to make it a conscious effort to lift those blinds up during the day so I can reap the benefits of sunlight. And when we're talking about vitamin D.
All of those points everyone's mentioning kind of ties back nicely to what Will mentioned. So if there's kind of a degree of predictability in terms of when more people are going to be affected by winter blues or seasonal affective disorder, we can kind of time public health messaging to target those periods so that people are most aware when they're likely to be affected by these things. So in the extreme cases, we talked about needing to see healthcare providers and, to get medications and stuff like that. But on the more milder side of maybe, like the winter blues, which does affect, it's less severe, but it affects more people. Maybe something as simple as routinely opening your windows when the sun rises and stuff like that. Providing those messaging to people can help at least stave off that portion of it.
I'm glad you mentioned messaging as well, because one of the things I was curious about is the stigma revolving around this disorder. Is that, because it's seasonal, is there a conversation or perspective that, you'll just get over it when winter's over?
Like it's normal or whatever.
And then educating not only the individuals who suffer from this illness, but people who have no idea of what is even going on, and educating them to be not as, ignorant on the issue, I think is also important for public health messaging.
Ben, you raise an amazing point. So all the Public Health Insight listeners, make sure you share this episode with all your friends and family members.
That's what you wanted to say. On a more serious note, so more to Ben's point, right? So in terms of stigma, I also know people who miss a lot of time off work because of seasonal affective disorder. And the general discourse in the workplace is that person X doesn't like to show up to work during these periods of time. Not kind of recognizing that this is like an actual chronic disease and disorder, and that it's not really like the person is just choosing to just be to cause inconvenience in the workplace. It's something that they're struggling with, and there probably needs to be a little bit more dialogue about treating this thing as an actual condition.
Right. Imagine if, the workplaces were able to modify someone's work schedule or had light boxes or things like that to accommodate for people to still, live with the conditions they experience, live with seasonal affective disorder, but like the best way they know how.
I promise we're not trying to get a light box sponsorship, but if
it might happen,
that's fine.
And as much as we talked about, winter pattern seasonal affective disorder, I think it's important and valuable for us to reiterate that this is only a portion of the broader discussion, right? As we mentioned earlier, there is a whole nother side of this condition that affects individuals in the spring and summertime. So I think it's just, there's so much more research that needs to be done, so much more, proper messaging to get the accurate information across, and just, improve public health communication and knowledge exchange. As we discussed today, seasonal affective disorder is more than simply having the winter blues. This is a complex and seasonal specific form of depression. As we enter the winter months and continue with life during this pandemic, continue to take care of yourself and your loved ones. Please seek help if needed. Thank you for listening.
Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our content and would like to stay up to date, follow us on Instagram, Facebook, Twitter, and LinkedIn. To learn more about our community initiatives and how you can support us, visit our website at thepublichealthinsight.com. Join the PHI community, and let's make public health viral.